Hello, dear friends. This is Sofya Dorinskaya with you. I am a psychiatrist and the head of the Center for Medical Information. Today, as I promised, I will tell you more about certain aspects of vitamins and their connection to oncology. Today, I want to briefly introduce you to a report that was presented at the All Union Vitamin Conference, which took place from June 19th to 23rd, 1939. The report at this conference was delivered by Drs. Alperin and Yosikova. They worked at the Institute of Blood Transfusion in Moscow. Their report was titled Vitamin C Metabolism in Health and Disease. So, let's briefly go over the topic of vitamin C again. Vitamin C is not produced in the human body, nor in guinea pigs or monkeys. Therefore, in order to survive, grow, and function at an optimal level, these complex living organisms must maintain a continuous and steady supply to their bodies of essential vitamin C. How was vitamin C deficiency determined in the past? It was determined by measuring its amount in urine. A vitamin C load was given, and then they observed how long it took for vitamin C to start appearing in the urine. Since vitamin C is not catabolized, that is, it is not metabolically transformed in the body, any excess vitamin C is always excreted unchanged in the urine. It doesn't get converted into anything at all in the human body. That's it. So this is how it was always determined by this timing. This was called the vitamin C load test. After how many days does vitamin C start to appear in a person's urine? And of course, this was, well, as it were, common knowledge at that time. Now, of course, I don't know who is aware of this, that the period when ascorbic acid starts being excreted in the urine with a daily intake of 300 milligrams occurs on the 1st to 3rd day in autumn and on the 7th to 9th day in spring, that is, both in autumn and in spring. People have a natural deficiency of vitamin C simply because foods are low in vitamin C, and Russia is a country where oranges don't grow year-round, where you can just take and eat as many as you want. So next, they talk here about how they took 16 patients with clinical signs of vitamin C deficiency and hypovitaminosis C. And when these patients reached vitamin C saturation, which again is determined by when vitamin C started to be excreted in their urine, it happened on the 17th to 21st day. This indicates a significant deficiency of vitamin C compared to healthy individuals. Well, of course. Or they waited 1, 3, 7, 9 days, or even almost a month, right? Next, something very interesting, and Professor Lepsky also talks about this, and they confirm it as well. The daily requirement for ascorbic acid in clinically healthy individuals who have recovered from vitamin C deficiency, that is, people who have been treated and are now clinically healthy, turns out to be increased. That is, even in a healthy person who has recovered from vitamin C deficiency, the body requires more vitamin C. Therefore, people who have recovered from vitamin C deficiency need to be given an increased amount of vitamin C for some time. Professor Lepsky says that a person, or rather an organism that has experienced vitamin deficiency, is prone to hypovitaminosis. Therefore, vitamin C should be given for a long time after a person has recovered from vitamin deficiency. No one specifies exactly how long, it's unclear. But here's what's interesting. This is the fourth point of their report. They took people suffering from leukemia, that's blood cancer. So, in their case, it was not possible to achieve saturation of the body with vitamin C. That is, its excretion in the urine did not occur, despite prolonged intake. This contrasts with the high initial levels of ascorbic acid in the blood and suggests a profound endogenous disorder in the absorption and metabolism of vitamin C in leukemia patients. Impaired or irreversible oxidation of ascorbic acid. As I understand it, this report has simply faded into oblivion, and no one has ever again tried to figure out what is happening, why people with leukemia cannot be saturated with vitamin C. No matter how much vitamin C they were given, it was impossible to achieve its excretion in the urine, and no one has investigated what is going on. Here, for example, I am led to think about a certain fact that is described by all the professors. It is mentioned by Lepsky and by Efremov and by Rice as well. They write that in the terminal stage of vitamin deficiency, the body no longer absorbs vitamins, but perhaps in this case the body does not absorb them, yet in that case it should have excreted them. So, for many individuals and for scientific researchers, this report is certainly one of the most significant topics that would be good for them to study in depth. Right now there are patients with leukemia. It would be worthwhile to investigate what happens to vitamin C, how it breaks down, or whether the body consumes so much of it. This is a severe form of vitamin deficiency. It's simply one of the manifestations, yes, of vitamin C deficiency, or perhaps a combination of deficiencies, leukemia. Or maybe there are some specific features involved. Or perhaps the vitamin C deficiency is so severe that the body needed to be given more, to be given it for a longer period, 2 months, 3, even 6 months, increasing the doses. But this is very interesting data, which, as I understand it, no one else has studied. It was 1939, you understand? Then came the Great Patriotic War, and it's unclear what happened to those people. I don't know, unfortunately, whether they survived the war or not, and so on. But for those of you who work in oncology, doctors, here is a topic for research. Here is data from doctors at the Blood Transfusion Institute from 1939. As I understand it, nothing has changed since then. Just as it was impossible to saturate these people's bodies with vitamin C back then, it's still impossible now. Here is one of the aspects why what happens in the body of a person with leukemia and its connection to a vitamin like vitamin C, because this is a vitamin that increases the bactericidal properties of blood, and along with vitamin A, it is involved in the immune response. That is, without vitamin C and vitamin A, a full-fledged, high-quality, benign immune response is impossible. This was Sofya Dorinskaya with you. All the best. Goodbye.